Primarily, elevating your testosterone will help with your muscle strength, will help with your libido, your overall energy level, just that get up and go that a lot of us lose. Elevating your testosterone will help with all of those. So the same way that we can help to elevate your testosterone is to actually give you something called DHEA. So it's actually a hormone supplement precursor that when you digest the DHEA, your body breaks it down into estrogen and testosterone. So it's a natural way of boosting your natural testosterone levels. It's released naturally by your adrenal glands, actually. And it's normally released in the morning. And so when you take DHEA supplement, it helps to boost that level overall. I have my personal recommendations. I recommend you take the DHEA in the morning because that's when our body naturally releases DHEA. And because this gives you energy and fights fatigue, I want that at the start of my day so I can get energy throughout the rest of the day. At the doses we prescribe DHEA at Winona, they're very low dose compared to what you would take for testosterone out there in the world, and so there is much less risk. You're not going to get masculinizing side effects from our DHEA doses. For women, testosterone has what we call a very narrow therapeutic index, meaning that if you get too high on testosterone, you can actually get masculinized side effects. And so DHEA, when compared to testosterone, is much safer in that sense. Some of the other symptoms you can develop when you're taking DHEA, or similar to testosterone, basically we can increase our oil production in our skin, which can sometimes equate to oily hair, increase of acne, which can happen for some patients, but usually these are temporary as your body gets acclimated to the medication.